Alan Tomola here. Welcome to my little but comfortable house. Ignore the dirty dishes behind the curtain. Today we're talking about treatment for cognitive perceptual conflicts, what in the past may have been referred to as delusions. Is delusion a bad word? It's not quite a four-letter word, but yeah, it's kind of bad. Think of all the bad things associated with the word retarded, and you're on the right track. Delusion comes from the Latin word delusio, which means to be deceitful, even if only to oneself. Essentially, when you say that someone has delusions, intentionally or not, you're calling them a liar, untruthful, deceitful, deceptive. Not a real good way to start a mutually respectful therapeutic relationship. Try to build a working alliance on top of that. Years ago, in my early training, many psychiatric professionals would say, you've got to confront patients when they say things like someone is controlling their mind. Tell them that's a delusion, plain and simple. Don't entertain that nonsense. This never really worked. Think politics. If you said, candidate A is a great person, and I really admire them, and someone you did not invite their opinion says, no, you're wrong, that's a delusion. Candidate A is a liar and a thief. How do you think you would feel? How do you think you would respond? A decade later, in my private practice, I came across many psychiatric professionals who would say, just flow with it, see where it takes you, uncover the client's delusion. If they say something like someone is reading their mind and it bothers them, put tin foil on their head to block the signal so they can rest. Yeah, this never really worked either. Think of how you felt the last time you said something that was likely not true. Like, that guy just cut me off. Jerk. I think he didn't want me to get in front of him to get into the parking lot to get a really good parking spot. Well, how would you feel or respond if someone said to you, yeah, they probably scattered it out 15 minutes ago, and knowing where the good spot was, they waited till you came along to block you out of all of these people just to piss you off. Can you say condescending? Sarcastic? If you say something you really don't believe, people can usually detect it. So what should you do when you see or hear a cognitive perceptual conflict with someone with whom you work? Carl Rogers would have said, be genuine, which is a great place to start. As we're talking about perceptual conflicts, however, think in terms of basic conflict management. Be upfront. You know, I've been thinking about something I wanted to share with you, but was afraid that you might be angry with me. 2, validate the relationship. You know, you're important to me. You're one of my favorite people with which to work. And I want you to be happy, but I also want us to be able to be honest with one another. Next, make a date to debate. Do you have a minute to talk about this, or would it be better for us to try to chat after lunch? Then, describe the conflict, be genuine, and don't judge. When you say that someone has inserted a controller in your brain, it makes me feel like you must be experiencing something truly painful, and I want to help you. On the other hand, I've thought about what you said, and I don't understand how that works. I don't even see how that could be possible. Can you share with me more about what you're experiencing to see if I can understand better? The creation of a cognitive perceptual conflict may be instantaneous. Confronting and altering that process, however, may take many sessions over a long period of time. You would want to have discussions to help you understand what need the individual has that the cognitive perceptual conflict helps them meet. For example, Bob might want to think of himself as a pretty good, happy-go-lucky, live and let live guy. After years of physical and emotional abuse, however, he still has angry impulses that he acts on occasionally, even though his abusers are no longer around. That makes others see him as a violent, sick person, a monster, which is not compatible with who he wants to be. So if you have a need to be a good guy, and you only have the choice between thinking, I'm a monster, and someone put a controller in my brain, which do you think you would choose? Remember, this choice is driven by emotion, not logic. So the choice does not have to be logical. Knowing these things may allow you to start building a bridge between Bob's perceptions and yours. For example, at some point, after you have established a therapeutic alliance and have built trust, you could start a discussion about the brainstem, where all of our animalistic and aggressive instincts are held. You know what, Bob? I think you're absolutely right. I didn't think so at first, but you are. You are right. There is a controller in your brain. I think it's your brainstem where all of these behaviors are controlled. After years of abuse, they turned off your switch and even blamed you for the family chaos. That was just wrong. They did not treat you right. The good news is, first of all, I can see what you're talking about, and it makes perfect sense. Secondly, I think you can recondition your off switch so that you can prevent the controller from taking over your mind, and people can see the sweet person I've come to know. If you're not providing psychotherapy, you may just be looking for what to say when Bob says something really off the wall while walking to the cafeteria. In this case, don't tell him he's wrong, and don't elaborate on it. Be genuine, and keep in mind there was a reason he shared his perceptions with you. Perhaps you look trustworthy. Let's say if Bob says to you, I feel like maybe I should hit someone in the face with my fist. A good response is to turn on your radar, keep a safe distance, and reply something like, well, that would be sad, Bob. Is there anything I can do to make you feel more comfortable? I want you to be safe and happy. Would you like to talk with Dr. Marks about anything? I could see if she's available now. Don't panic, don't judge, and don't threaten back. When you get to a good spot, be sure to tell your teammates what you saw and document the event, including your intervention and his response. One more thing. In a controlled environment, you could insist that someone not discuss the controller they believe that's in their brain. If you get every doctor, nurse, attendant, and therapist to confront the person each time they mention it, guess what? They will learn not to talk about it. Not because they don't believe it, but because they feel attacked each time they share their inner feelings. You can get compliance, but this is not healing. In fact, it's abuse. As soon as they leave the controlled environment of the hospital, where their sense of being controlled has been reinforced, guess what? Their delusion or cognitive perceptual conflict comes back with a vengeance, and we act surprised and say things like, see what their delusions did to them? Now, you've got this. Let's review. A belief that a person has, which is not true, is called a cognitive perceptual conflict. Such a belief serves to help the individual meet a specific need. You should not tell the person that they are delusional or wrong. Similarly, you should not play along with the delusions, pretending it to be true. Be genuine and use conflict management skills to negotiate an understanding of what it is the person is experiencing that brings it closer to mainstream understanding. Don't worry if your intervention doesn't always work. If you were an investment banker, not every investment would always work out. It's the same here. Just be genuine. That's the key point. Be genuine and stay safe.